Action.
All right, I'd like to welcome everybody back today, Alabama Care. We have Mrs. Anna McConnell, the State Autism Coordinator at the Alabama Department of Mental Health, ADMH, and Mr. Jerimie Goike, the Office Manager and Receptionist at ADRS here in Homewood. And today we're going to be talking about Autism Awareness Month and autism in general. And at this point, I'd like to hand it back. Mrs. McConnell, if you would introduce yourself.
Hi, I'm Anna McConnell. I'm the State Autism Coordinator and work with the Alabama Department of Mental Health. There's a lead agency of the Alabama Interagency Autism Coordinating Council, or Autism Council, to make it easier, and also participate with that.
Now, are you originally from Alabama?
I am. I'm born and raised in Birmingham and went to Tuscaloosa long enough for grad school and came on back. So I've loved getting to see autism in Alabama and be able to work in the state where I've grown up.
So we always like to ask, is it Roll Tide or War Eagle? And it sounds like it might be Roll Tide.
SEC. I'm an SEC. It can go either way. So gotta root for all of them. Whoever's the underdog, we can go for.
Oh, I like that.
War Eagle.
And Mr. Goike, if you would introduce yourself.
All right. My name is Jerimie. I am the, as mentioned, I am the office manager and receptionist for the Alabama Department of Rehab Services, going on almost 25 years. I'm a motivational speaker and a self-advocate in the autism community, and been doing that for about the better part of 20 years. And I have served on the Alabama Interagency Autism Council, did both terms. And I currently serve on the UAB Regional Autism Network at the moment. So,
very cool. And are you originally from Alabama?
Yes, I am. I grew up in Anniston. Lived there from when I was 5 until I was 18, and then I moved to Birmingham when I was 21, and started working with ADRS when I was 22.
And as you mentioned, you said War Eagle.
Yeah, War Eagle. Yeah, that's talk about underdogs. That's that's about as underdogs as you can get.
Unless you got Cam Newton as your quarterback, then you're looking pretty.
Yeah, exactly.
Okay, well, today we're going to be talking about navigating autism, and I'd like to kind of kickstart it here with, what is ASD? And I'll hand it back over. Anna, if you would give us your take on that.
So autism is a developmental disability, and it looks different in lots of different people. It's autism spectrum disorder is the new name. It's gone by lots of different names in the different DSMs. But really you're looking at repetitive interests and behaviors, and then also some social interpersonal communication difficulties. And so it looks different with lots of different people. But it can go from having a really hard time to functioning to you may not even know that somebody is struggling with something, because you can develop coping mechanisms and coping strategies. But there's lots of other things that go along with autism that usually co-occur. And so that's what we tend to have to find supports for and be able to meet more needs for.
Now, when you mentioned that it's such a wide range, it seems like it would be hard to diagnose and hard to provide services.
Yes, absolutely. And so it's also misunderstood, and it can be scary for somebody who doesn't know how to serve it, because it could look so different. And so, but typically it's what helps me understand is it's something that we probably all struggle with, being anxious, thinking about something and wanting to change the subject, and it's things, but it's a lot more with autism. And so it meets that threshold within the DSM-5 for those repetitive and restricted interests. And then also the social interpersonal, and that's where you can run into a lot of issues, and it can make people uncomfortable. And so that may be another difficulty. But it really, I've been able to learn so much from people with autism and their families that's really what has drawn me to it. They've been able to accomplish so much. And Jerimie is a prime example of a self-advocate and being able to help show people some of the ropes and some of the things that work and don't work in Alabama, to be able to navigate and get the supports and services that you need. So.
And Jerimie, what does autism spectrum disorder mean to you?
It's well, a lot of like what Anna said. One of the things I really caution people in my lecture is that it is so wide, you know, that is so widely varied, that it's not all Rain Man. Um, like the movie with Tom Cruise and Dustin Hoffman, where he was more like a savant type individual, where he knew stuff and really knew a lot of things, and could just round off something to you just in a matter of nanoseconds, and stuff like that. Um, and my autism was actually pretty mild. I've always thought, um, and whatnot. And in fact, there was a brief period of time I thought I might have been, I might have a little touch of Asperger's syndrome, and stuff like that, because I've always been more sociable than say someone who may be more of a savant autistic. And another little analogy I like to use a lot, that I take from Rain Man is, well, I love music, and I have a very vast knowledge of, especially like classic rock music. Before I became a photographer, I used to be a DJ and did that for about 10 years. And one of the things I can really do that I've always been known to do well, and I've been challenged it a few times, is if I'm listening to some classic rock station on the radio, I won't need but maybe just a couple chords, from some guy's guitar, and can already tell you, oh, that's Pink Floyd, Comfortably Numb, and then I can tell you some background stuff about that album, or what Roger Waters might have did, or what Nick Mason might have done with that song like that. And there's been a couple of times I've been in a party, and I got actually put to the challenge of that. I actually had a friend who got his laptop out once, and just started randomly punching up classic rock songs on YouTube, just seeing how fast I can tell them.
Yeah, kind of like a speed run of guess what song this is.
Right, right.
That's interesting that you say music. I have a family in Arizona that I grew up with, in Philadelphia, and they have a son who has autism, and music is a very big coping mechanism for him, where he likes to have his headphones on, and that
Same
helps
here.
him kind of center and focus. And he has a job, and he's living very well, but he really enjoys the comfort of having the music kind of be there
Yeah,
for him as a focus point. So
yeah.
now, Mrs. McConnell, you did say coping mechanisms, and hard to really diagnose there. I'd like to ask both of you, what are some coping mechanisms that you guys have seen in the community?
Do you want to go first, Jerimie?
Yeah, I got one right away. That actually relates to music, and it's actually still a little habit, I still do today. Um, when I was initially diagnosed with early childhood autism, one of the first habits I developed right away, um, when I listened to music, was rock, just like that, and it's still something I do a lot today. And during my youth and school years, I used to, when I'd come home from school, the first thing I used to do was I'd run to the bedroom and turn the stereo on, and would just do that for about 2, if not 3 hours on end, just going through my records and my tapes, that we had back in, even some 8 tracks, that I would listen to, and that was how I got through some very, what would be some stressful times, that I would go through in life. So, all right.
And so that kind of thing is looking for that sensory input too. And so that rocking can really have that soothing effect. We have some friends that we're neighbors with now, and the daughter loves to swing, and it's that vestibular response that they're looking for. You may also see some other stimming activities, sometimes with fingers, sometimes with light, sound. There's a lot of sensory sensitivities to be aware of as well. So loud noises, fluorescent lights, the hum. There's lots of different things, and it looks different for so many people. And so I've seen preferred items, preferred activities, and so that can be coping. But if they're not helping someone in the community, and if it's not one socially appropriate, so it may get you in trouble, or not help you focus or learn, then you have to develop some of those replacement behaviors that may help, and then to show where's an appropriate place to do that. So just like what you talked about, Jerimie, so you go to your bedroom and do it. Well, that's great. You have all the time to do what you need to do. There was a movie where it said if you're nervous in public speaking, you get a paper clip and you can fidget with that. So, I mean, it's kind of relatable, but it's a much deeper need, physiological need for people with autism. And I hope I'm describing that appropriately, Jerimie.
Oh, that's good. Well, and to the swinging for a minute. From when I was about 3 until I was about 5, I actually had kind of a problem where I would just run, just go running from the house, wandering. And if I went into a neighbor's yard and found a swing set or just found a swing, I would swing in it, until I was eventually found.
They go, who's on the back swing? The kids are, at their aunt's house. Who's swinging in the backyard?
Yeah,
it happens a good bit.
Yeah, I had had one incident where I had wandered off, and some big burly guy had actually found me eventually, and I don't know how he got me back to our house because I wouldn't speak to him. I was just scared of him because he was a big black gentleman, and whatnot, and so I don't know how the heck he even got me home, but I mean, when he did get me home, and and got me to Mom, he was like, "This your boy? This your boy?" Yeah.
Yeah, there can be a lot of safety concerns for elopement and wandering and running, and so sometimes they say even calling the 911 operator system and notifying them of triggers, of tendencies, preferred locations, if they are attracted to water, because that's a really big issue and we don't want any drowning.
And I was one
also
of them.
neighbors.
I was bad about that, but just how that guy got me, how that fella, eventually got me to the house was just a miracle, because I wouldn't speak to him, and we went to, and I do remember we went to 3 or 4 houses before we finally got to ours, and I remember he'd knock on doors, trying to figure who I belonged to.
Well, it takes a village, and sometimes it takes a village to do a lot of things.
Yeah.
I'd like to follow up on that. As a family that might have a son or daughter that is young from that 3 to 5 age, do you see a lot of families kind of knocking on their neighbors' doors like, hey, introducing, this is my son? And Jerimie, did your family do that growing up? Did they have a strong relationship with the neighbors, and were they proactive in that respect?
When we lived in North Carolina, yes, which is where I did the bulk of my wandering off. We lived in North Carolina from when I was 2.5 until I was 5, and that is where the reason why we moved there was so that I could go through that TEACH program that I talk about in my lectures at the University of North Carolina, Chapel Hill. We lived in Fayetteville because my dad was in the Army, so that he could be stationed at Fort Bragg. And yes, we had like 2 or 3 neighbors that lived next door and across the street that we were, pretty good friends with, that knew me and took a like in me, and and stuff like that. So they were able to watch for me if needed, but and whatnot.
Now, Mrs. McConnell, is that something that autism awareness on the state level you speak with families about that have young children? You say, hey, this is something that we recommend, is getting to know your
So we
neighbors a little bit more and reaching out?
Well, that for community, absolutely, and for help. So on a lot of levels, we do recommend having a safety plan, know what the triggers are, know where they like to go, have a plan, who to call, who to ask for help. But for elopement and wandering, also, it's lots of other things. So there's more levels to that notifying. There's Project Lifesaver that you can have the bands to help know where to go. You can locate with radio. But also, if you're a family member, a parent, caregiver of somebody with autism, it can be a very isolating experience. And so being able to reach out and have that community takes some courage because it's hard. And so I know in some of the things just that we've done in the community, there's been other parents who have said, I just want y'all to know up front, my child has autism. And you see it displayed, but it's also a great teaching moment for other kids. I have a 6-year-old. And so I've tried to teach him about autism, but it's really hard to describe unless you meet a variety of people. And so to be able to, he went, oh, that's what it is. And so, but he can see that some of the traits show themselves more at some times and not at others. And so making sure that one, a lot of burden does go to siblings. So making sure you have that sibling support. Even the younger siblings, I've definitely seen where younger sisters take care of the older brothers and in any form and fashion. And so making sure that they have the emotional support that they need, as well as navigating financial issues later. But it's really that community support. We all need community. We all need other people in those relationships. COVID's made it worlds harder because you're getting people out of routines. They're not practicing social skills. They're not able to go and engage and get supports other places like school or other places for that 3 to 5 age. So things that you describe for young children definitely progress. And so sometimes you can remedy those to be able to develop the coping strategies, make changes. But then as they get into adulthood, some things may persist. It depends on the individual and how they fall on the spectrum and the needs that they have. But making sure that those services and supports show themselves differently through puberty, through transition age, getting to adulthood, and the service options change through those as well. So it's definitely something to talk to with parents of young children and community, but it's even more important because you have more and more that are older. How do you help? How do you interact? Know that somebody may not, I know Dustin Chandler, he may have been on before, but he's former police officer, does emergency training. It may look like something else, but it's not. It's just they're struggling with autism and having something going on at that moment that they may need help with. So,
yeah, Mr. Chandler has been a guest, and we're looking forward to having him on again in the future. And he has a lot of experience, as a police officer there, and then also as a father and family man. And so we're very grateful for, everything that he's doing in the community and sharing that experience. I want to touch on a few things that you said there. The learning opportunities at a young age. In doing some research for today's broadcast, I did come across some cartoons that were meant for younger age kids, and it was teaching what autism might look like in their environment. And it gave an example of, there were a few young kids, I'll say 3 to 5, that had walked into a room and someone was playing with a railroad set. And they were being a little noisy when they came into the room, and then tried interacting with the individual that was with the railroad set. And he would say, well, this railroad set is this kind of, and he would go right into the models. And I thought they did a very good job of presenting what that might look like to kids. And then it was very accepting, like, oh, okay, this is a cool train. Let's talk about this. This is what you want to talk about. I thought that was a great learning opportunity there. And then you also mentioned that routine is a big thing, and going to school. And I'd like to ask you both, how do you guys feel about someone that might be in those very formative years, I'll even say like 3 to 10, that need that school structure and haven't been able to get it during this pandemic and this lockdown? What do you guys think is happening there, and maybe what we'll see coming out of this?
Jerimie, would you like to go first?
Sure. Yeah, I really have some deep concerns and some troubling concerns with the pandemic, with how it's preventing a lot of the younger children on the spectrum getting the social interactions they need. And I've actually have written some articles here lately about my personal aspects of the COVID-19 crisis. And I really have some deep. I feel like we don't get out of this soon. We're going to see some. I'm afraid we're going to see some PTSD stuff going on. In fact, one thing I'll touch on right away, and I've written an article about it, is with all these mask requirements. Ever since of a medical trauma that I went through when I was about 3, I do not like to watch like medical dramas, or just I don't like to go to the hospital or the doctor's office unless I have to, unless there's a need. And going into Walmart and seeing all these knuckleheads running around with masks and rubber gloves, to me is like, it's bringing the medical environment into places where it does not belong. It should never belong. And that's and I won't lie to you, when I go in and see that crap, my anxiety kicks up, and some of that old PTSD I thought I had finally had passed, and finally had put it in a dormant state, if you will. It's been starting to unravel over this past year.
I think that's a great example of something that when we're young takes us through some trauma there and sticks with us as we get older, and can come back in unexpectedly, almost like being blindsided. This has done. I know there are things in my life.
That's exactly what's happened with me.
From when I was growing up that made an impact on me, and then it'll come about later. I'm like, well, why am I feeling this way, or why am I reacting this way? And it's like, oh, if I look back, it's kind of anchored. It's something I got to continue to work on and work through. Anna, when you see families at large in the state of Alabama that have young kids in the K to 10 right now that are struggling with the pandemic, and as we start to come out of it, but what are you seeing kind of statewide is going on for families and what they're doing?
And so statewide, I know there's been a lot of discussions about special education and access to those IEP plans. How do you go about IEP planning at the end of last year during COVID? What's it even going to look like? How does that work? I know kids have been in and out of school just due to exposure, sickness. I mean, it's just been, this is not a routine driven year for school aged. And this is just, my son's in first grade, and it's okay, but this is not ideal. And if there was autism in the picture, gosh, that would be so much harder. And that's on the individual level. But then on the state level, when you hear about families that have multiple children, they need to be able to have access to a computer. Do they have internet access? The child is then using a device, maybe a phone, real good at getting that game that they want to play. I mean, so it's trying to monitor that. That's just a step beyond. And so in a lot of the data that I've seen about parent financial concerns, PTSD, lots of other things, autism has been a standard deviation beyond other disabilities. And so when you talk about things that are consistent among disabilities, it's a standard deviation beyond that. And so I think that's really telling when you talk about concerns and issues with families. It's more isolating. You have less income. So, I mean, you talk about out of work, but gosh, they were out of work before because they're taking care of their child. Some have chosen to homeschool because it's easier, but even pre-pandemic, because they may not feel like their needs were getting met in the school. It just depends on the family, depends on the situation. And so some school systems have done great, and some it's not a good match. And so it's really being able to identify those needs, to address circumstances. Some of it is dependent upon a teacher and how they operate. Some are more structured, others are not. People with autism tend to do better with structure. And so it's those kinds of things. It's going to be different, but statewide, it's really, really, really been a struggle with the back and forth, the lack of routine, because I know there's some of the older population who, because it's so much back and forth, they can't get their kid to go back to school. And it's not just my child won't go, it's a grown, almost grown, just old enough to still be going to school, and he ain't doing it. And so you're risking triggering a lot more things that are worse. And so the school is working with them, trying to get them to go, but it's really disruptive to families, to schools, to learning, and to gaining those social skills, because you build across it. And then you talk about summer losses. It's a compounding avalanche that you can feel out of control with, but that's also where, if you can find a sense of community. So a lot of found it online, with other community support groups, other parents with autism, have children with autism at varying ages, or somebody just to say, I need you to go. Your husband's staying with the kids, find your sister, find somebody, and you're going to get a break. And you're just going to go, even if you have to stand outside, just to make sure that self-care is happening as well, because that's what has suffered the most, I think, in addition.
And it's a lot of times people, it gets kind of swept under the rug, and we don't talk about the mental health enough during this pandemic. We always like to try and give actionable things that somebody could do today. And so especially in that young age, it can be a little bit tough. But what I hear both of you saying is social interaction is really key. So whether that's going to the park and being somewhere outside, but being around others and being able to socially interact is something that, it sounds like we would recommend whenever you can get that together.
And to practice skills. So it's not that you jump into a big pile of kids. That would be overwhelming. I don't know if I'd volunteer for that one, but to be able to go in and say, we're going to practice saying hi. How do you say, do you want to play with me? Come play with me. And so practice some certain skills. There's different folks you can reach out to, even other parents, books, websites, reach out and try things. There's behavior analysts that may be able to help identify some issues and then ways to address those, to be able to go and interact. So even small increments, celebrate every success. So
go ahead, Jerimie, if you're good.
I was just going to back to the mask thing for a minute. Another concern that I really have very deeply is that when they're making us wear masks and interacting, people with autism, when they see the mask, they've lost the ability to detect expressions, facial expressions. And that is something I went through very intently during my time at Teach. I mean, I went through flashcard drills, learning what's happy, what's sad, what's, concern, or what's, this, or, what this might be, these different, types of, expressions. Without the mouth, you just, it's for someone with autism, well, it's like, well, you just pulled the legs out from under me.
Mm-hmm. And any ability to know that you've learned to be able to do that. I will say there's quick plug with the Regional Autism Network. They have a YouTube channel that helps the kids working on that mask wearing. So if that continues for kids to be able to practice that, and it's in Spanish, there's a number of different videos like that. But I mean, that's part of the social interaction. You don't understand facial expressions as well. And so it really.
Yeah.
That brings up a really good point. And I read another article, this is a couple months ago, but it was during the formative years of a child, how important it is for them to see the mouth when speaking and learning words and being able to mimic that. And that wasn't being given as much, especially in the school setting or out in the community. And so, the article was, how are we going to compensate for this in a few months or a year when that was really important for that child at that point in their life? I would like to... I am going to ask the question, but before I do, I'm going to acknowledge chat here. Sarah Williams says, War Eagle. So, Sarah, it's good to have you here, War Eagle. Sharon Glenn Henderson, also War Eagle. Anthony Lewis Sr. says, I love Rain Man. It was a great movie. I've seen that a few times. And Sarah Williams says, music is one of my biggest coping mechanisms as well. Thank you for sharing that, Sarah. Amanda Tomlinson Chandler says, my son is going to be 13 tomorrow. He's always been into rock music, mostly classic rock. He tends to enjoy simpler 3-part bands like the Police. He always loves Bowie. And loved Enya for sleep time. He's been into more electronic music lately, like dubstep. It has always seemed that when he needs calming, music can be a tool to assist him. I'm just thankful I don't have to endure garbage music to soothe my child. So you're enjoying the music that your child is listening to. Thank you, Mrs. Chandler.
Well, I was fortunate enough to have parents who were hippies, and they grew up in the 60s, and I got to experience life a little bit in the 70s. So I got the full brunt of classic rock music. I mean, from Bad Company and to the Police, and my bands have been Rush and Van Halen, and like the Police, Rush is not but a 3-piece band, but when you listen to some of their songs, you will think you're listening to a 6-piece band, because I like Rush because I play the drums, and I loved Alex, who Neil Peart, who plays the drums for Rush, and then Van Halen has Alex Van Halen, and I've been lucky enough to see Rush twice before Neil Peart lost his life just last year on the drums, and been able to really get that. That was one of my couple of my bucket list things I got to check off that I got to do in my lifetime. And but yeah, I love the classic rock genre is probably what I listen to the most. But I also like a lot of I will go into other rabbit holes of music, and I do like Enya, and I do love some in the 90s. I really got into like some of the new age stuff like Yanni and Enya, and Steve Roach, just to name a few. That, in fact, when I come in from a photo shoot and I'm going and working, do some stuff on Photoshop for a while, I do love to turn on Pandora, and I will go in there and select a few channels of some of the new age stuff that I want to listen to while I'm editing my photos.
Mm-hmm. I really enjoy listening to music as well while I work. It kind of blocks out a little of the other distractions there. I'm going to continue to acknowledge chat here. Yolanda Lapsley, good information. Mrs. Lapsley, it's good to see you here today. Kenya C. Taylor says good morning. And Tamira Meehan says, my niece is smart, not savant, but lacks the common sense / immature for her age group, has fixated on cosplay and anime, writing stories, and constructs figurine and draws at 15 years old. Used to flap hands and constantly wiggles or flexes fingers. Has meltdowns and little dramas over stuff we'd think should be able to do. So those sound like some of the things that you would see that would put somebody on or categorize somebody to be on the spectrum there, as you were talking about, Mrs. McConnell. I would like to ask here, what percentage of the population is on the autism spectrum disorder?
And so right now it's 1 in 54. So the way that those numbers are calculated, it's with the CDC and their outreach project and surveillance data. And so it's 1 in 54 8-year-olds, and that has held steady since 2016. And I've got all the numbers in front of me. In the 90s, it was 1 in 10,000. And so when you think about age is the other part. So 1 in 54 may not be Jerimie's cohort, but so in 2000, it went to 1 in 250. So, I mean, it was a pretty drastic jump. And so one thing that you're looking at, the 1 in 110 was 2006. And so when you're looking at kids, say they're born in 2000 even, well, they're 21 right now. And you're talking about 1 in 250 for the 8-year-olds. So you really need 1 in 88. So if you put that in perspective, 1 in 88 would be on the autism spectrum, and they're 21 years old right now. How are we helping them? I think that is probably some of the strongest questions that we need to ask ourselves for just the great need, and to make sure that Alabama does catch up to meet those needs, because it's happened so fast. We're all just trying to catch up and figure out how to help.
If anybody counted back in the 70s.
Yeah. Thousands and thousands. Yeah.
There's quite a jump over those the last 30 years. If you would speak a little bit about your thoughts on why that increase was there, why so much of an increase during the last 30 years? Do you think it was more of diagnosing, availability, or something else?
Mm-hmm. Jerimie, do you want to go first on that one?
I would say probably knowledge, because I mean, when the 90s came, that's when we got the internet. And well, before I became a motivational speaker or even a self-advocate, one of the first things I did when I got internet myself, and this was back in the days of AOL and CompuServe, and and you had to sit through that series of listening to the dial tones and calling the number, and you think you're calling, you think you were calling Interpol when you tried to log on back in those days. I remember the first time I actually Googled autism before there was a Google. I think back then it was Yahoo, was the main search engine. And the first thing that popped in my search results was Temple Grandin, and started to learn about her and started to see a lot of myself in her. And at one point, one of my coworkers actually loaned me a book, her Thinking in Pictures book. And there I really started to really kind of discover things about my own autism. I actually met Temple twice at a couple of conferences where I was either a keynote speaker or I was doing one of the breakout sessions, which was really cool. Stuff like that. So I think, probably in the 90s, I think the reason why we saw the sudden surge in the 90s, if you will, was because of internet and technology just, got better after that. Like I said, I would love to know what it might have been in the 70s, because I was diagnosed initially in 1976.
And the DSM has changed over time as well. And so you have stuff going on in the 40s, and then it progresses, and then Asperger's is added to it. And then it's all combined into autism spectrum disorder. And so that's changed over time, but there really has been a higher recognition of this. And further ahead, my concern would be that it would be classified as a mental health issue or an intellectual disability. While that absolutely can occur with autism, I have a feeling it was probably missed, but there's lots of research on that. I don't want to speculate, but we do know that there's more awareness of the diagnosis and more people looking at it, and it's more recognized in the DSM.
The amount of information that we're able to get our hands on now with the internet is awesome. And I feel like it's really changing our society in a way. More information is a good thing for more people to be educated about a number of topics. And sometimes we can see it where, we get in our little circles and we don't, talk with other people outside of that, and we can, that can lead down a different rabbit hole. But I think having free information out there is a good thing. You mentioned how to navigate it. Yeah, exactly. You mentioned some of the needs. A lot of the people in 2000 are now 21, and what are we doing to help those individuals? If you both would speak about some of the services and the help that someone with autism would receive throughout their life, from early childhood to early school, high school, and then maybe a little bit after high school. Some examples there.
So some of the things that we see are, so the birth to 3 would be early intervention, but you also would likely see speech therapy. So speech is one of the first things that's noticed, one of the first therapies that people engage in to get early intervention. They go, oh, there might be something else here. But typically, I think in Alabama, the average age of initial diagnosis is still 4, when you can diagnose it too and earlier. And so we still have a lot of work to do on that end. Preschool has different qualifications than early intervention. So you may or may not go from early intervention, if you even got that, to preschool. And so that is a big gap that we need to work on, making sure that services are available and people know how to access them for that age. Then you have school-aged services. So basically, primarily through an IEP, but it's important to note that those are educational services. They are not medical services. So you have educational eligibility. They may provide medical supports in the school, but it's based on, for autism, and educational eligibility. So that will not transfer to, say, when you go and need autism specific services, you can't say, well, the psychometrist said. It has to be from a licensed physician, psychologist, something like that. So that's something that has been a little more tricky to navigate because a lot of kids are identified later in schools when they've missed a lot of other opportunities. And it can be hard to get a diagnosis in Alabama if you're not a little. And then when you start hitting 14, you can start working with vocational rehab. There's the Workforce Opportunity Innovation Act, I think, WIOA. And so Voc Rehab with ADRS manages that. And so you can start with some of those transition services. Parents can ask for it. You don't have to wait for the school. So just as a little tidbit, parents definitely can request all of these. And so that's the school services, but you still have that medical undertones of it. So what happens in the school, what happens when you come home? Because you may have a whole different situation at home and the rules may not match, and you need matching rules for different situations because the ability to generalize to say what happens at home is the same rule at school and vice versa is difficult for autism. And then when you get to 21, that's the magic age where you get Voc Rehab, which is great, to be able to help with some job support. But unless you have an intellectual disability, you're not going to have long-term care. You might be able to get some services with mental health, but it's if you have an SMI, severe mental illness, like bipolar or schizophrenia. And so even making sure that you have medical coverage to know how to navigate that, to be able to get disability, SSDI, to get your Medicaid. It's a process, and there are so many issues. We get so many calls from adults. Jerimie is like success story central for being able to have a job, live independently, do all of the DJ photography, pursues his passions, and is amazing at it. I mean, to be able to advocate for himself. But there's so many too. So that's why it's important what Jerimie does, because he's also speaking for other people who can't speak for themselves, but you can absolutely see the needs. So that's part of what the council does and continues to do. The Regional Autism Network did a survey with constituency board members, and it was access to services, so service navigation, being able to actually get them, and then adult services were the two primary issues, and they are absolutely wrapped into each other. So that is something that Alabama needs to work on, because what happens? You did all this work and then poof. So we do have lots of needs in this state. But
now, Jerimie, actually, Jerimie, I'm going to ask you to hold off a little bit, because for everybody watching, Mrs. McConnell will be with us for a few more minutes, and then Jerimie and I are going to be going through a little bit more in depth together. So Jerimie, we're going to hold off a little bit until we do more of the one-on-one there. Now, you mentioned that after the 21, and a big word that we hear in the community a lot is waiver. And I have a family member that has an intellectual disability, and she's on the ID waiver. Now, is there an autism waiver, or do you think there's one in the works?
So there is not currently an autism waiver. And my understanding is that CMS, so Centers for Medicaid and Medicare Services, federal Medicaid, will not approve an autism waiver. They used to, but they would prefer to see a DD waiver, so for developmental disabilities across the board. And currently, Alabama is an ID state, meaning you have to have the intellectual disability of IQ of 69 or below. And we know that autism has a wide range of IQs, and you could still have a higher IQ, but not be able to do the self-care, make sure you're managing your funds, hold a job, all these things and have the independent skills. So it may take a lower level of support to get there, but it may also be a constant level of support to where you can acclimate some of those skills and be able to build them. But, and then there's others who absolutely have high needs and will continue to have high needs.
Now, there are a few things that you mentioned that we're still working on, especially navigating and the transition to after 21 and long-term services. I'd like you both to kind of highlight what you think has been a very positive thing, both either federally or in the state of Alabama for ASD over the last maybe 30 years. Something that you kind of like to plug and say that, you know, we're still working, but look at what we've done so far.
Jerimie, you want to go first?
I'll do one. Yeah. I really feel like there's more work to be done, but we're doing better than I would say where we've been, say even 45 years ago. And I was diagnosed at the age of 2, and I was actually diagnosed by an Army psychiatrist when we were living in Europe. And that's where my whole life with autism actually began. And during that time, my folks somehow found out about the TEACH program in North Carolina, and then that's when we would begin the transition of leaving Germany, and we would come back to Alabama for about 3 or 4 months until Dad could get things situated in our home in North Carolina, and then that's when we moved there, and then that's where I would live there until I was 5, you know, going through their program. And they took me from having no social language developmental skills to having most of that by the time I was about 7. And here's something else. When I came to that program, the TEACH program was actually was young. It was established in 1972, and I came there in 1977, and at that time you had to drive to Chapel Hill to the university. That's where we went and did all of my therapy stuff there in sessions and whatnot. And now that program in North Carolina has progressed to not just having one center in Chapel Hill that I always had to go to, but every metro like Charlotte, Fayetteville, Asheville, all have a TEACH center, kind of like how ADRS has a voc rehab agency in every metro of Alabama.
Mm-hmm.
Yeah.
So it sounds like you're really highlighting early intervention there, and that's come a long way from what it used to be. Yeah. And Anna, is there anything that really sticks out for you in the past few years?
So I really think, and this is a broad answer, but the collaboration and cooperation among anybody in the autism community, whether you're an individual with autism, a family member, a service provider, an educator. When you have the Alabama Autism Conference, they just had their 20th year, and that was really a good time to get people together. After that came needs assessment, a task force, the council, and so you build this group that continues to meet and continues to collaborate, and it doesn't turn into territorialness. It turns into, I've got something that might help you. Have you tried this? What about something else? And so when you build on that, we've got regional autism networks now that are at 5 universities and provide training, information and referral, lots of different community education that are available online. We meet twice a month to be able to talk through issues. There's constituency boards that Jerimie referenced. He's on one where we get their input, and that helps inform, in addition to all these other surveys and data. But what it does is it builds your data. And I know that's a short word with a lot meaning behind it, but gosh, that really does help when you want to bring it to the legislature or to be able to say, look at the needs. So just like kids who were born in 2000, there was 1 in 88 prevalence rate. It's a quick way to say, wow, look at the need, and then you can get the stories behind it. And then also with Department of Mental Health, we have new autism services. And so we have care coordinator staff. I'm so excited about those, to be able to go into homes. And so that's continuing to roll, but it's also a really good jumping point. So we can learn and continue to serve this birth to 21 population and hopefully apply what we've learned to these other needs that we see, that we get phone calls about every day at Department of Mental Health and at the Regional Autism Network. So it's that collaboration, cooperation across agencies and individuals that builds upon itself. And I know we've had other people come to our state to speak, and they say, well, y'all work together pretty well. Going, well, we do what we can. And so I think that's something that we should be proud of and continue to highlight and work to our advantage.
Yeah, that collaboration, it sounds like it's kind of snowball affecting and just getting bigger and bigger.
Yes.
And you mentioned the data there and speaking with legislators and representatives. I've never spoken with a representative like that, but that's something that we've had broadcast about legislative advocacy, and they say the data is what, will really sometimes poke through a lot of the other language out there. Being able to do that.
Partners with those advocates is what's important, to be able to say, here's the data, but you tell your story. And that's what makes the impact.
Mrs. McConnell, we're going to go ahead and start to wrap it up here for you, and then Jerimie and I will be together for a little bit. But before you go, is there anything that we haven't talked about that you think an individual or a family member could benefit from hearing on about navigating autism?
Reach out and ask questions. There are phone numbers of people who can help connect you in your area. And so the Regional Autism Network and DMH Autism Services, we are not the experts. I always say parents are the experts in their child. We can help point to some resources that you can see what matches and to fit, or for yourself. So those are at the mental health website for autism. I can chat that to you later if you wanted to put that up. But not even that, just find people in your community to be able to bounce ideas off of and to help. Doesn't matter if you're in a small community or a big community. I used to work with networking and support groups, and some of the best community support came from those rural towns. Just like Jerimie said, where somebody can find you and know where you belong and bring you back. So, but that's partnership as well.
Mm-hmm. Get that ball rolling at the family level. Reach out a little bit and get your own snowball rolling as well. Yeah. Well, Mrs. McConnell, I want to thank you. Oh, I'm sorry. Go ahead.
I just said staying healthy, taking care of yourself too. It's important during COVID, I think, is the big issue. So. Yeah,
that was something that we talked about, me and my family, is when the vaccine started rolling out. Would my family member that has an intellectual disability be able to get the vaccine, or would her caregivers be able to get it first? And then when you think about it, it's like, well, if her caregivers can't take care of her, she can't take care of herself. So you really have to take care of yourself before you can. It's like putting the oxygen on yourself when the plane, before you start helping other people. Mrs. McConnell, thank you for being with us today and sharing everything going on in autism in Alabama. And at this point, we'll go ahead and let you go. I know you've got another meeting, and the easiest way to do it is just go to the X up in the top right corner and close the window.
Thank you.
And we'll see you.
Yeah.
Thank you again.
Bye, Jerimie.
Don't go anywhere.
Bye. Yeah. All right.
Okay, perfect. So
Cool.
Now we have a little bit of time with Jerimie here, and I kind of wanted to dig in a little bit more. So for everybody watching, doing a little bit of research for today's broadcast, I came along Jerimie's YouTube channel, and I started watching some videos, and I'm just blown away. Jerimie, if you would talk a little bit about some of your motivational speaking and some of the stuff that you've done at UAB and other areas.
Well, for the past 20 years, I've been a motivational speaker and self-advocate, and basically what I try to do is take my audiences kind of on this like personal journey, if you will, from the time I was diagnosed with autism, and I try to take you through what it was like, how important the early intervention was needed, and what life was like at the Teach Center in North Carolina, and what some of the things that we did there. And that's really kind of the centerpiece of my lecture too, that I really love to highlight a lot. And one of the promises I made to myself when I became a motivational speaker was that someday I would return to North Carolina and be either a keynote speaker or be in one of their breakout sessions sharing my story. And in 2007, I made good on that promise and went back to that center for the first time since I had been there since like 78 and 77 and whatnot. Yeah, that was my first time actually stepping foot in there in almost 30 years. And actually being a keynote speaker at their annual conference. And oh man, it was just like going back in time. You know, it was definitely. I've took a lot of trips down memory lanes before, but that one was probably one of the most pinnacle ones I've done in my 47 years.
Now, Clifton, I mentioned that we're going to go to the photos first, but if we could, I would like to plug your YouTube channel if you're okay with that. I'd like to pull it up on screen so others can see it. And Clifton, if we can go ahead and share that, and then we'll also put it in the chat so anybody can click on that link. But I highly recommend going and following Jerimie's YouTube channel. And here you can see some of the various topics that he's speaking on. And Jerimie, I noticed in one, you're speaking to, I believe it was future teachers or maybe teachers at UAB.
That was the bulk of my audiences. I have a good friend of mine who taught there. Her name was Karen Dolly, and she was one of the professors at UAB's education department, and she taught students who were going into special ed but were in the graduate part of that program. In other words, they were in, I think they had already went and got like their bachelor's, but then they were coming back and getting their master's in special ed. And her and I worked together about a good 10 or 15 years where she would call me. She pretty much had me on her speed dial whenever the semester came up for guest speakers. And, I was always the first, she would hit, and I would come either on a Saturday or I would come in the evenings. Sometimes I came after work and would talk to folks. And I've also done several lectures with the UAB Sparks Center and still do today. Yeah.
I have a family member that goes to the UAB Sparks Dental. And they really help her out there. She's not a big fan of having her teeth cleaned or brushing her teeth, but it's very important. We go there once a quarter actually. And they've been very helpful in her hygiene for her mouth, her dental hygiene there. That's what I mean.
Good, because I have a story on that too. When I will not lie to you, my very first trip to the dentist when I was about 4 was not fun. To really add to the situation, I grew up going to the Army dentist, the dental center on base, and they're pretty much get you in, get you done, get you out. Yeah, and I still remember it having like 4 guys holding me down in that chair, and I remember fighting them tooth and nail until it was done, till it was over.
I think that my family member had the same. So my grandparents, my grandfather was in the Army, and his daughter, who is my aunt, has an intellectual disability. She kind of went through the same things, but they were on base, until she was maybe 30, something like that. Or, being treated through the Army there. And so I think that she would resonate very highly with that. And funny enough, she did get diagnosed at a young age through the Army doctors. And I kind of want to take it through. You've stressed early intervention before. If you could talk a little bit more about maybe your earliest memories in North Carolina and how that really made an impact on you.
I will say my time in North Carolina going through the TEACH program was actually some of my more happier times in life, because every time I went there and I got to see my therapist, and we would go through whatever drills that we were going to do that day. One of the things I remember most was they really tried to gauge my interest in things. And there was this book, which I think is still being made today, called the Richard Scarry's, All About Town book, I think is the name of it. And it's where it used animals doing, people, things that people do all day, and most of it was like work and home, and a lot of it. And I remember the book had a lot of these scenes of where the cat or the puppy dog was the policeman, or the fireman. One might have been the truck driver. And at that time, I was really interested in. I loved like big trucks and cars, and because that's what my dad did in the Army. His job in the Army the whole time was he worked in the motor pool and worked on the like personnel carriers and heavy equipment stuff that the Army used. And there were some times where he would take me out to the motor pool and we'd play on the trucks and stuff like that. So
That sounds
when
pretty
they
cool.
got me to like, yeah, it really was. And so when I would go to the teach center, we would do those flashcard drills and stuff like that. I remember, that's how they got me to open up a lot during that time. That's how they got me to interact, was by gauging my interest.
Now, if you could tell us a little bit about going from teach kind of to the public school system and what that looked like for you. At what age were you?
When I was 5, we moved back. We actually moved back to Alabama, and we moved back to Anniston. And so I went into the first grade when we were living in Anniston. Public school, I'm sad to say, was somewhat good, but then it was not so good. One of the examples I can give, when I was about 9, I was in a PE class one day playing baseball, and I was trying to understand some intricacies of the sport, and I got ready to bat, and so I hit the ball and started running bases, and the coach said something, well, you need to stay on this base, and so I did. And for some reason or another, one of the staff thought I was being smart, or not doing what they wanted. So I actually got pulled off the playground and went and got paddled for it. Got paddled for that. I kid you not. Yeah, took 3 licks for that. And that was even after I tried to reason with the teacher. I was like, well, I was standing on this base, waiting for them to tell me what to do next. Yeah. And they didn't buy that either. And so after that, my mom pulled me out of that school, and we actually found a private school. And that's where I would go. I went to Trinity Christian Academy from when I was 9 until I graduated. And actually there on out, that was a better time. That was a much better time. They had a really great special ed program there, and really had a great teacher who I'm still friends with through Facebook. I'm actually still friends with a lot of the staff from that school on Facebook, and still keep up with a lot of my friends on Facebook through that school. But there I would be more involved probably in anything and everything that I could get my hands on than what I've ever would have been able to do in public school. I was on the junior varsity basketball team for 3 years, and even became the team manager. Did that until I graduated. I was also on the drama team and took speech, and that was where I found my interest. That was where some of my interest in becoming a motivational speaker actually manifested itself. Was by doing that. I was on. I was involved in a lot of when I got into high school, for example, I was I was always going to my regular classes. I was mainstreamed a lot. It got to a point where I was only going to the special ed class like 1 hour, like one period a day. And after that, I was upstairs, with my peers.
How did you, because that's something that we see more and more is like a blended classroom
Yeah,
type of environment. And how do you feel about that? Did you really enjoy that, being
I
with
loved
your
it.
peers?
Oh, I loved
Yep.
it. I loved it. Yeah. And actually, when I graduated high school, I was actually very sad that it was over. I actually went through a little depression funk for about a year because I missed the social supports that I had so much there at that school. And like I said, I still, because I loved some of those, I love so much of those people I knew. That's why I still stay in touch with them on Facebook. And
Hmm.
what I actually love about Facebook in that aspect was when I got on Facebook, I had not talked to most of them or most of anybody for a good probably 5 to 10 years until Facebook came along and I started finding, a lot of my classmates and started finding a lot of the faculty then. And, it allowed me to reconnect with them for the first time in say 5 or 10 years or so.
Yeah,
Yeah.
Facebook's kind of like a phone book where it's really nice to be able to catch up with people that, I grew up with in my
Right.
childhood, but we just moved away or everything like that. But
Yeah.
it sounds like you really started to flourish when you went to the private school.
I did.
Kind of maybe not coming out of your shell, but you talk about joining the drama club, playing basketball, really getting involved in all aspects of what being a high schooler is all about.
Yeah.
Being social
I
with your
did.
peers.
I stayed involved as much as I could. I mean, I never, that's something I never gave an inch up on.
That's
Yeah.
amazing. But you mentioned, and I've had this happen with me a little bit too, where I've been a part of a system, and then that system ends. And that happened for me when I was in college. I was involved in a sport in college, and after that, I identified as being, kind of an athlete in college, and I didn't have that structure of my team there all around me all the time, and the workouts and the practices and the games,
Yeah.
and for a year or so after that, it was like I was almost lost. I didn't know what to do. And so, if you could tell me about how that first year went after high school.
That's exactly the way, just like you said, I was just lost, for about that first year. I mean, I was starting to work, um, when I first initially graduated. I actually left Alabama and went up to, Clarksville, Tennessee, which is where my dad currently lives. And I got a job with the PX on base, which is like the military Walmart. Um,
And they have great
and I
prices, by
worked
the
there
way. If
as,
you ever get an opportunity to go to the PX, they beat everybody else's prices.
yes, they do, especially in electronics. I will tell you, if there's anything I miss about my privileges that I had, um, like for like going on base and doing stuff, going to things on base. Yeah, I miss that with a passion, dude. Yeah,
Yeah.
because if you want some good deals on like electronics, oh my gosh, the PX will nail Best Buy every time. I mean,
Oh yeah.
these brick and mortar stores that we have don't even stand a chance
So I
because
moved to Alabama like a little over 4 years ago to help out with family, and my grandparents,
right,
who I was helping with a little bit as well. We would go down to Montgomery to the PX maybe
right,
once a quarter, and we would just get like 3 shopping carts and fill up all the
oh yeah,
freezers and everything because the food is just it's great and it's at a lot lower price. So we would make a whole day
oh
trip out
that,
of it to go down to Montgomery.
oh yeah, and it's tax free. Um,
Hmm.
even the commissary, I mean, even the commissary could knock out, what Winn Dixie, or Kroger could do. No,
Yeah.
I'm sorry. Yeah, if you got access to those privileges, don't let them go.
For sure. Oh, so you moved up to
Yeah,
Clarksville, Tennessee, and you're working at the
right.
PX, and so pick us up
Yeah,
back there again.
I was there. I was actually their ID checker slash customer service person. What I did there was I kind of stood at the front like a bouncer at the bar and checked military IDs, and then I would like do some customer service related stuff. Show them where things were at, or if we had some particular sales going on. So that required a lot of interaction. With the public. And it actually become I've actually kind of thought of that job as kind of a precursor to what I do now with ADRS.
Yeah, I can
Because
see
like,
that.
um, well, what I liked in particular about that first experience of doing that line of work was that I love the military and I love to support our guys. And I will tell you what, interacting with fellow military service people versus the civilian population, oh, it is like night and day, bro. They are always respectful, they're always, kind, they're courteous. And if someone needed like information like electronics, I was always eager to pounce on that. And what I loved about that was a lot of military guys, were like me, they loved electronics too. Um, to take it to my dad for a minute, he is a music buff too, and has always had stereos and stuff. And he actually plays in the band too. He's a drummer,
Oh,
and,
really?
and still plays in bands too. So he's the reason why I love music the way I do. Yeah, I mean he's the one that would when he would come home from work, it would be nothing for him to come and crank up the stereo and we listen to some Stones or listen some Hendrix or stuff like that. That was some of my favorite memories that I always have of me and my dad and my love of music. And when I listen to classic rock music, that's where I'm always taken back to.
Now, you mentioned you play the drums. Do you still play the drums consistently?
I don't now, but if I can get behind a set, I can do a few things. I don't have a set of my own, but when I go see Dad, I'll get on his, and we'll swap some stories, about some different moves or different music, and we'll do that for a couple of hours or two. Whenever I go see him, he actually played in this one band that was called Geezer, and it was basically him and three other guys that were all retired military, and they were all over 50, and they just played nothing but your classic rock music from the Vietnam era. And they had an old saying that we're not young, we're not dead, we're just somewhere in between. That was the motto of the band Geezer.
I really like that you
Yeah,
still get together and are able to play with your dad when you want to and jam out there and really, share his
right.
experiences that way. That's really cool.
Yeah, yeah. That was
Um, so if you could so you're working there on the PX, and then you said about how long were you there at the PX?
almost a year. Sadly, I had to come back to Alabama because me and his wife, my stepmom, just didn't get along on some issues. When my father went to Korea, he remarried. Yeah, my parents divorced when I was 9, and my dad remarried when he was stationed in Korea. And I actually have a half brother from that. He's now 31. He's married, and they have a 10-year-old daughter. And so I'm an uncle, and they live in Clarksville too. So I always love going up to see them when I can. Yeah,
That's very cool to support
and
family there.
yeah. So yeah, when I had to come back to Alabama, that was kind of a bummer too. Because actually, when I lived in Clarksville, it was there I learned about using public transportation. I learned a little bit of how to get around because I don't drive anymore because of a medical condition with my eyes. I'm legally blind, but I can still see some with my glasses. And, some people like to ask, well, how do you do photography? I say, well, I see better through the camera than I do with the naked eye. And I got a friend of mine, he has this old running joke. He said, yeah, that old guy, he can't see worth a shit, but he can take a damn good photograph.
So when you moved back here to Alabama, what was that transition like? I mean, I've moved a few times across the U.S. and it's always hard, rebuilding my
Yeah,
social circle, finding out where I'm going to live, what I'm going to do for work. What did that look like for you coming back to Alabama? And how old were you at that point?
I was almost 19 when that happened. And actually, when I came back to Alabama, that was when I started learning about AIDB and started learning about this trade school called E.H. Gentry Technical Facility. And when I came back here, I started getting involved in that. And when I started going to that school, it was there I started taking some computer classes there. And like high school, I was starting to get some of that social interaction stuff back again, which was kind of, which was kind of nice.
Mm-hmm.
And that's where I lived at until I was 21. And then when I was 21, I moved to Birmingham. And I actually had two other jobs in Birmingham before I started working with ADRS. I was actually a part-time secretary for a nonprofit outfit called the Special Education Action Committee. And kind of like the Autism Society, they do a lot of outreach and referral stuff for for children with special needs.
Mm-hmm.
And yeah, and
Now,
then
if you,
after that, I went to work. I'm sorry.
no, go ahead. I'm sorry. I cut you off. I apologize.
Uh, no, it's all right. And then after that, I went to work at Office Max as a data entry clerk and did that for about 3 or 4 months, and then they just let me go. And that job was just as well. It was not a good fit.
Yeah.
And then a few months after that, that's when I went to work for ADRS. I started at ADRS in October of '96. I moved to Birmingham in 1995.
I like how you say that you did have a few jobs there, and you mentioned that the Office Max just was not a good fit. And I think that's a really important thing is to try different things and see what does feel
Yeah.
right. Because you're never going to know right off the bat. You can't figure it out just reading from a
No.
book. You actually have to be there and experience what it's like. But you do have to put yourself out there and you have to try it. And if it doesn't fit, that's okay. Something will. But you got to be willing to keep
Yeah.
going at it.
Yeah. You do.
Mhm.
All right.
So you've been working with ADRS for quite a while, and we've met. For everybody watching, we've met. We were saying probably 10 or more times when we go in to do a broadcast at ADRS in Homewood. Jerimie is always the first person I see when I come in the door. And so I'm grateful that we're spending this time together. This is actually the first time we've had an in-depth conversation to get to know each other a little bit. I would like to talk a little bit about housing and homeownership. If you
Sure.
could give a little bit a
Oh,
background on that.
sure. Be glad to. Um, well, in Birmingham. I rented up and from '95 until 2005, and my first apartment I got was at Ski Lodge. Then I had me a little swinging one room apartment on West Valley Avenue. But the only good thing I can say about that little place was it was near work. That was about it. Other than that, it was isolated. It was away from stuff. Um, if I needed to go somewhere, I either had to call a cab or get the bus and whatnot. And I lived there from '95 to '98, and then I found another place from 98 to 2005, I moved over to a little area called Crestwood in Birmingham, and I found I found a 2-bedroom apartment on Montclair Road that was adjacent to Eastwood Mall and Central Plaza, when all of those 2 malls were still, the happening place to go to. There was also the Eastwood Festival, and just a lot of number of things that I could walk to over there. I mean, there was even a good old Hooters restaurant, I could go to, watch a ball game and have a beer. There was that. There was also even a bowling alley over there called 48 Lanes. One of my sports I love to do nowadays is I bowl, and I've actually bowled in leagues.
Oh, really?
And I have my own gear. Yeah. But I used to go to 48 Lanes when it was still there until it closed. And nowadays I actually go out on 280, and I bowl at Riverview Lanes out there a lot. That's where I actually did some of my league bowling for a little while. And what I love about bowling is, unlike most sports, bowling is the most accessible, probably universal sport that someone with a disability can do. I mean, you can be in a wheelchair and bowl. You can be an amputee and bowl. And I've met some people with disabilities who bowl and do pretty well. You can be a 7-year-old and be and bowl. You can be 80 and bowl. I mean, it's just so that sport is just so universal in so many ways. That's what I love about the sport. And I actually used to do it a lot when I was a kid too. My friend and I used to go to the Fort McClellan bowling alley a lot when we were kids and bowl there. So that's kind of where it started. But okay,
I'm really bad at bowling. I don't think I've gotten above like 130 before ever in my life. I'll use gutters if I have to. But you bring up a really good.
When they're doing all that cosmic lighting mess, I have to request bumpers myself. See, and that's just another example of how it's accessible that sport can be, accommodatable. But anyway, back to the housing. I lived in that apartment until 2005. And then about 2004 to early, I decided, I think it's time to get a home. And one of my goals ever since I moved to Birmingham was I've always wanted to live in South Side and be close to like 5 Points. And because I love to go, I like to go to a bar and, listen to a band every now and then and have a drink. And I just love to be, where I can get out and do things. And South Side was that. And I bought a 2-bedroom, 1.5 bath townhome that I've been living in now for going on 16 years. And I actually got this house through a program called the American Dream Down Payment Initiative, which back in the early 2000s, Birmingham had this little program where you could, if you made under a certain income bracket, you could qualify for $10,000 scot-free money.
What?
Yes, you qualify. I mean, you right off the bat, you qualified because of my income bracket I was in at the time. I was given a down payment of 10 grand that I was able to, use as a down payment, to purchase on this house. And that's how I was able to, get the financing, that I could get, to buy this house. And I was, and because of that, I was able to go through a full conventional mortgage loan and not deal with some, PMI or like some kind of FHA, type loan, for someone who may be on a low income bracket, wanting a home. I was able to, go full fledged and buy a house, buy this house outright, just like everybody else does. And one of the things I love about sharing this story especially when I do my lectures, before I moved to Birmingham, I had both my VR counselor I had at the time in Anniston, and some family members and some friends. They thought I had a head full of rocks. That I was going to leave Littletown and go to the city. And here I've been
So
doing it
it
now for
feels kind of
26
nice.
years.
Like, hey,
Yeah.
you remember when you said I couldn't do it, and look at me now. Look.
Yeah. I got a house, dude.
Yeah.
I've got a mortgage. I got a mortgage now. Remember when you told me I couldn't get an apartment? Well, here, I got a mortgage. You want to pay for it? Yeah.
Oh, that's struggling sometimes when other people put limiting beliefs on others, and
Yep.
sometimes it's like you just got to get away from them for a little bit and not listen to
You
them, and
do.
just say, hey, if you're not going to support what I want to do in my dreams, and I'm going to
I've
have to
had to
just
do
step
that to
over
a few
here.
folks. Yeah, I've had to do that to a few folks, and I have friends who have had to abandon certain family members, and sadly, some of them don't even speak today. Despite what
Mhm.
they've been able to accomplish and overcome. Yeah.
Uh, as we kind of wrap up here, I want to highlight some of one of your hobbies that you spend a decent amount of time doing, and that's photos. And
Okay.
if you and Clifton, if you want to go ahead and bring up Jerimie's webpage there for the photos, and Jerimie, if you would just give us a little bit of background about how you got into photography, and then maybe some
Sure.
of the airplane photography that you do.
All right. Well, my initial interest in photography started with my love of art and creativity. When I was newly diagnosed with autism, one of the first hobbies and interest I took up, along with music, was my love was to draw and create things on paper. And 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 one of the things I really love to draw and do a lot of was mechanical drawing and art, any kind of like drafting type drawings. In fact, I got into drafting as a hobby for a while during my teenage years. I actually had a drafting table at one point, and had all the little templates that I used to love to play with, and I would draw maps, I would draw planes, I would draw just if it was technical or mechanical, I would draw it. I used to even get the owner's manual for like the washer and dryer or the dishwasher, and would draw from it. I would take a blank sheet of paper and draw what I saw in the, might copy the diagram of the dishwasher onto the paper, and stuff like that. So that is where and that's why I've always loved planes, because of just the
Mm-hmm.
mechanical aspect. When my parents divorced, my dad would send me plane tickets every summer, and we'd rotate the holidays. So I started flying like by myself and traveling by myself at the tender age of 9. But before that, I'd had some experience of flying, like when we had to come home from Germany and stuff. And then there was a couple times we flew, from North Carolina to Alabama and stuff, visiting family here. And just ever since then, that's why I've always loved planes.
I
And the
have a
other thing I like
question.
about that is, sure.
When we're going through these photos here, it almost looks like the planes are standing still, but I know they're going really fast. How do you capture an image like that without it being blurry? Like if I were to try and take an image on my phone and something was moving in front of me like that, it would just be a blur, I feel.
I hate to tell you, but it's all in the technique. It's most of what I know about photography I've learned out of the owner's manual and YouTube. Um,
Hmm.
but and it's the cameras. My current
And I see
cameras
you
I
have
use are Nikon. Yeah,
I see you have
I'm
a few
sorry.
of the Blue Angel pictures there. Funny story. My grandfather on the other side of my family worked for McDonnell Douglas, and they built the Blue Angels. And we would go to a few shows around the country, and we would watch them. And they would fly so low to the ground. And often I felt
Oh
like
yeah.
they would try and scare you, like they'd come out of nowhere and just
Oh
right
yeah.
above you, screaming there.
Yeah. Well, my current cameras, and sometimes I rent some cameras. I'm a Nikon user, and my cameras I have can shoot 7 frames per second. So that's how you're
Wow.
getting. That's how I'm getting these particular, the ones that you're looking at right here. That's how I'm getting the details that you're seeing so much of, is that fast. Is because of that fast shutter speed, and well, some of the stuff I've done, that I would do to my settings on the camera. I mean, I could explain that to you, but we would be here half the day.
Yeah, no, I
um,
understand. It's above my head for sure.
yeah,
So
and
this
a
is
lot of
really
it's
cool, the
just.
photography stuff you do. And do you have an upcoming shoot, or do you have something that you're planning on doing in the next year that you're really looking forward to?
I actually do, and unless COVID or the politicians get in the way, one of my dreams in air shows is to someday go to Oshkosh, Wisconsin, and attend their annual EAA air adventure experience that they have like all week long, and it's basically like a Woodstock for aviation junkies like me. And I was initially supposed to go like last year, but COVID had other plans, and so I'm planning to go in July, um, and that's when I'm planning to go up there. And actually, the way I got hooked up to go to that finally was I have a coworker at my office who moved down here from Wisconsin, and her family just so happens to have a home in Oshkosh, and I got invited to stay at their family home and go to the air show while they do their family activities. So that's
That's
how that
amazing.
that's how that works. Yeah.
Yeah, it's like a cool place to stay with a good family and close to the air show. It's like a bang bang. Yeah,
Yes, sir. Yes, sir. Um,
that's really cool.
but but yeah, but my love for photography originated from my love for drawing and art, and that's the one thing I will say. Um, I mean, I had a good 10-year run as a DJ, but I felt like during that time, I felt like my creativity stuff and my artistic stuff that I love so much kind of got neglected during that time. And then that's when I got my first camera in 2008. That was actually the beginning of the end of my DJ career. And I got out of I in 2010. That was when I sold all my DJ gear stuff and actually said goodbye to it, for good. And I have no regrets, and I don't look back. you know, Yeah, it was a good run. I had a great time with it, when I when I found photography, oh, it was just like it was just like a 180 that just went around.
Well, you take
Yeah,
awesome photos, so I'm glad that
thank
you
you.
do it and stick with it. So,
Yeah,
is there any place
I,
close by that you would really, if somebody's interested in photography in Alabama, is there like a favorite place of yours to take some pictures?
oh yes. Not only do I love aviation stuff, but I love to do a lot of historical architecture. I love to do landscape stuff and scenery type stuff. In Birmingham, we are just rich with good architecture, historical places. And when you get some time to go on the site, you will see tons. You will see several galleries, just where I've like been up and down Highland Avenue doing some shoots, going downtown, going under the viaducts, and doing some shoots. Going to Railroad Park has always been a good place. But now for landscape and scenery, North Alabama is a paradise. Get up around Gunnersville, Muscle Shoals, Athens, Blount County, Walker County has really got some gem. Has really got some good gems. Little River Canyon's a good place. I'm hoping at some point somebody will take me up to Gunnersville when the eagles come to nest, so that I could go up there and watch and photograph them, and stuff like that. I love to do sunset shots. Cheehaw is a good place. I grew
I've
up
been to
going to Cheehaw
Cheehaw
all my
before.
life. Yeah. Well, see, when I lived in Anniston, going to Cheehaw from Anniston was like, people here going to Old Mountain.
Yeah.
It's not but an hour's drive or less.
Now,
So I
have you
spent
ever
a
been
lot of my,
to the Tannehill Ironworks?
yes, sir. Yeah, there's a whole gallery of that on my site. You can go look at, that I did. Yeah, Tannehill a couple of falls ago.
That's
Yeah,
a really cool place.
I
That's out by me. I
love.
live in McConnell, so it's like right next door to me.
Okay. No, no, you're not far from it then, bud.
Mm-mm.
Yeah, you're not far at all. Yeah, I love
Uh,
it. Yeah, I'm not much of a summertime person. I just don't do hot weather. So that's probably when my cameras just don't come out as much, except for like 4th of July, as you saw. Yeah, my house is underneath Vulcan. If you're wondering how I got those awesome shots of Thunder on the Mountain, yeah. I mean, God forbid if he falls off his pedestal, chances are he'll be in my driveway. That's how close I am. His torch would probably land on my driveway. Yeah.
No, I was looking at those pictures the other day, and then I saw through your YouTube video that you live very close to Vulcan there, and I was like, that's how he's got to get those shots.
Yeah, those fireworks shows you're seeing, I shot those from my driveway.
So,
That
if
was in my
anybody
driveway.
watching, if you want to go watch the 4th of July fireworks
Yeah.
by the Vulcan, you
Hey,
got to hit up Jerimie. Maybe he'll let you sit in the front driveway there.
hey, come on. My street's a block party anyway on 4th of July, so so it won't be nothing new. Me and all my
Um,
neighbors, we get together, we fire up the grills and kick it, break out the beer, and yeah, we have a good old time out here.
Soon
Yeah.
enough, I'm looking forward to it. As we kind of wrap up here, Jerimie, is there anything that we haven't talked about that you think someone watching or a family watching would really benefit from hearing?
Just that if you got some passions, pursue them. Don't neglect, don't don't deny. Back to early intervention for a minute. If you think you're having some symptoms or you're seeing some signs, get an intervention, get help right away. Because the more you delay that, the lesser chances I think you're going to have, as far as the outcome that I've had. Yeah, early intervention is kind of where when I lecture, I do. That is where I will thump a Bible. I'll take a Bible and thump it, in that department. Don't deny that. If you got yourself a dream, work hard, believe in yourself, because I know damn well dreams do come true. Yeah.
Well, sir,
All
I
right.
appreciate you sharing that, and thank you for those words, and thank you for being with us this morning. And
Sure.
it's finally nice to kind of talk with you a little bit. I feel like we've met each other
Yeah.
quite a few times, but we haven't really got to know each other. And I'll probably see you. I think we're doing a broadcast. It'll be within the next week or two. So
All
I'll be
right.
in the ADRS Homewood offices in the next couple of weeks, and we'll have to catch up again.
Sweet. Yeah. Do it. Yeah. So are you
Yeah.
Alex? Okay.
Yes, sir.
What's your?
Yep.
Okay. All right. Yeah.
And you
So
usually
you're in
see
Clifton.
myself and Clifton. Yeah, and Clifton is the brains behind all of the streaming and the equipment, and I'm just a talking
Right.
head. So
Yeah.
we,
Yeah. Well, I've been
well,
on both
Jerimie,
sides of that. So. All right.
it's been an absolute pleasure here today with you. And like I said, I appreciate you being on with us. And maybe we'll do another one in the
Sure.
next month or two and just kind of catch up and see what's going on.
Yeah. Do it. Yeah. All right. Well, you
All
guys
right,
have
sir.
a good
At this
day,
point,
and yeah,
yep, I'm going to give you the goodbye there, and then I'll see you in a few weeks.
you bet. You have a good day. I'll take care.
All right. All right. Bye.
Bye.